A new study says cancer cases and deaths have grown considerably between 1990 and 2023, and that trend is expected to increase in the next 25 years, with millions more deaths expected. Jennifer Yoon joins us now with more on this. Jennifer, what do researchers say is driving this trend?
So it depends on what country you're talking about. They say it's a bit of a mixed bag. One thing they talk about in the report are preventable behavioral factors, things like using tobacco, drinking alcohol, not eating a healthy diet, and that seems to be linked with over 40% of cancer deaths, according to the researchers here. And while that's not good news, the researchers also say that there is room for improvement there because people can make a choice and stop engaging in those behaviors. So that is something that researchers say is hopeful. Another factor that they're pointing to is access to early screening and access to treatment. And in many countries around the world, especially the ones that are showing the worst outcomes, that is still a difficult challenge. Take a listen to one of the co-authors.
Breast cancer is the leading cause for females. We know the majority, not all, but the majority of breast cancer, if they are diagnosed earlier, the chance of survival is very high. That doesn't exist in many countries in the world. That's why you see low income and low middle income countries where there is no access and no equipment for early diagnosis, screening is not very high. You see that disproportional mortality in these countries simply because of that.
And the other factor, the elephant in the room here, is age. In many countries around the world, the populations are aging, including here in Canada. And as you know, Ian, the older you get, the risk of you getting cancer goes up. And we're seeing that reflected in these numbers. As you said, considerable numbers. We're talking about a 75% increase in cancer deaths in 2050 compared to 2024. Millions more new cases, millions more deaths.
Big numbers, because we're looking at cancer rates around the world. Let's zero in for a moment to Canada. What's the situation here?
So as I mentioned, our population is aging, and that is what we are seeing largely here. So much so that when researchers actually tried to control for that, take age out of the equation, they saw that cancer case rates and death rates actually were on the decline in the past decade. So that is good news, but not enough to dull the absolute numbers. We are still going to see more cases. We're still going to see, unfortunately, more deaths as well. We're not bucking that global trend. And doctors say that we need to start preparing now.
It's a multifactorial solution. I mean, we need to do better with our efficiency, our scheduling, we're beginning to use artificial intelligence for scheduling, for example. Like, do you really need to have a chair for 3 hours? If you've got a simple chemotherapy, it can be half an hour. We need to be a bit better at delivering care at home, getting people out of the hospital and doing that.
And, you know, the population has been increasing and aging for a while now, right, Ian? So doctors like Dr. Stewart there are seeing the strain already. They say they've been managing, but as they see these numbers, they are worried, especially about sophisticated treatments, things like bone marrow transplants or CAR T-cell treatment. How accessible will they be for everyone? Will we be able to keep up that level of care that we want to in the future?
Jennifer Yoon in Toronto, thank you.
You're welcome.
For more insight into the report's findings, let's go to Dr. Timothy Hanna, a radiation oncologist and a professor in the Department of Oncology and Public Health Sciences at Kingston's Queen's University. Dr. Hanna, what stood out most to you from the findings of this report?
I was really impressed by the massive increases in the number of cancer over time. This is a big problem in wealthy countries and also in countries with limited resources. I also was really impressed by the number of cancers that can be dealt with via prevention and early detection. I think that was a real strength of this study to point that out.
Yeah, and we're going to get to that in just a moment. Now, Jennifer did talk a little bit about some of the causes and the effects in terms of rising numbers. And I know we're talking about a global study, so it's really complex. But how is it that we're seeing an increase in the number of cancer cases and deaths at a time when there have been so many advances in treatment?
Right. So a lot of the increase, both in Canada and internationally, boils down to population growth and population aging. There are more people and they're living longer. And so even if we find ways to treat cancer exceptionally well, there are still people that are getting cancers, and many cancers can be prevented or detected early, but not all.
Let's talk about prevention and takeaways for people. And I know that when you discuss this, you like to divide it into 3 categories. So let's go through those. First of all, on an individual basis, give us some cause for optimism. What should we be doing to try to reduce our risk of cancer?
Right. So if you're eligible for any type of cancer screening or prevention, take advantage of that as an individual. If there are unhealthy aspects of your diet, not enough physical activity, it's a challenge for everyone. Tobacco or excessive alcohol use, and any of these things that we can adjust in our lives can be very beneficial when it comes to preventing cancer.
Yeah, the alcohol one is interesting because I certainly grew up in an era when there was no suggestion that there was a link between alcohol and risk of cancer. And then just a few years ago, it was identified as a Class A carcinogen. So that's something that a lot of us are still trying to figure out, what is a safe amount. So smoking definitely has been clearly identified as a risk. So there are individual things that we can do. What about a second category, which I guess we can refer to as systemic?
Right. So at the system-wide level, we can invest in timely access to quality care. We can ensure that we have adequate resources for prevention, early detection. In Canada and many other countries, primary care needs to be bolstered. This is a really important gateway into the cancer system. Many people are diagnosed through primary care. And also thinking globally, we can support World Health Organization and United Nations initiatives that are aiming to improve the control of cancer around the world.
Yeah, so you talked about the third category, global. Listen, we have maybe half a minute left, but I want to pick up on something you said because I think it's important and maybe we don't give it enough attention, and that is there are a lot of Canadians that don't have a primary care provider, whether it's a doctor, of course, or a nurse practitioner. So let's finish with that, the importance of all of us having access to that kind of primary care.
Yeah, it's crucial, and this impacts cancer diagnosis. It impacts the journey through cancer treatment and follow-up, and it's of course not limited to cancer. A primary care provider, in whatever form that takes, is able to take very general symptoms and determine which ones to be worried about and which ones not. They're incredibly important to us as individuals. So anything we can do to increase access is so important.
I do have one last question, and that is, I think about people in your profession, and every day, probably literally, if you're, as your work as a clinician, you're seeing people at the beginning of a journey of cancer, and in some cases, it's not going to end well. Is it difficult to remain optimistic in your job?
No, I think that we're incredibly fortunate to live in an era where we have so much to offer, and that's what keeps me very optimistic as I face people with cancer every day.
All right, Dr. Timothy Hanna, a radiation oncologist and a professor in the Department of Oncology and Public Health Sciences at Queen's University. Thank you.